Oh, just wondering if you can see my screen. Not yet. Okay, let me see. Now you can see my screen. Okay, thank you. Thank you for the nods. Okay. So thank you for your patience in commencing this webinar today. So my name is Lee Ridden and I'm an occupational therapy student, and I've had this amazing opportunity to work in the space of FND Australia under the supervision of Dr. Catherine Gill, and it's just been so insightful working under Kate and with my colleagues Sky and Emma. And today's presentation is an area that was a goal of mine in coming to this placement, to understand more about pain and to be able to work with some pain assessments. I have a particular area in this field because it's something that affects everyone, and it has a specific area in terms of occupational therapy assessment in working with people with FND. So without going too much further with the presentation, I'd like to acknowledge the original custodians on the land in which we live and work. And I'd like to pay respects to the elders past, present, and those emerging. I'm presenting today from Darug Country, which is in Western Sydney, and it's the area of the Barra-Madagal and Bidjigal people. And if you'd like to enact some acknowledgement wherever it is that you're attending from today, in whatever way is appropriate for you. And I know that everyone in Australia, who lives in Australia, we all find ourselves very fortunate to be on this country. So this presentation is about evidence-based approaches to pain assessment and pain management. And I was hoping that you'd join me in some practical aspects as we go along through this presentation, because it's more than something that can be addressed through theory. Pain occurs in our body and in our minds and with our emotions. So it's multifaceted and it's quite complex. So I found that during this placement, working amongst people with FND lived experience and with their caregivers, that it's presenting differently in every body. So no two people with FND look alike. So FND is short for functional neurological disorder. And so it's a disorder that affects the sensory motor pathways. And something that a lot of people find easy to describe is that there's like a glitch in the software between the signaling and the hardware, which is the sensory motor part of the brain. So this diagram that we have on the screen is the homunculus, and you can see the red areas or the pinky areas for the motor cortex, and then the lighter blue for the sensory cortex. So it's around the midbrain. And for some of the factors that influence functional neurological disorder, it could come from a family history, or it could be set off in the body from a virus. There could be an accident or an incident that started the symptoms or not. So FND treatment and research is situated at the intersection of neurology, psychology, and physiology. And so neurology works with the diagnostic aspect of FND go and see the treating professionals of neurology to obtain a diagnosis. And then the psychology is dealing with the mind and how the mind works in relation to the body. And then the physiology is really having a lot to do with sensory motor in terms of the impact of how we can retrain the body. So let's consider now that we're living in a world of healthcare where patients are diagnosed and treated according to their personal experience and not an area of medical expertise. However, in saying that, in the field of occupational therapy, our role is to assist people to do what they want to do and what they need to do, and to support them in what's meaningful in their life, because that is a determinant in the quality of life. So OTs are person-centered, and we aim to foster therapeutic relationships with our clients and their caregivers, because we understand that they are the most informed people about their condition and how it affects them. So in the space of FND, I've been working with clients but in the NDIS sector, where they're called participants. So you may or may not be involved with the NDIS. But even so, OTs can work with you to assess your environment and how supportive your environment is for you, and collaborate on goal setting, and to work within your functional capacity, or maybe assist you with some aids, some way of supporting you in your functional capacity. So we provide education and intervention for people with recommendations, and we also provide reports. So OTs work best in partnership with you and your caregiver, that's been said. But what's also important in terms of FND management is having a multidisciplinary team of health professionals to assist you. So in doing this, we gather a total list of symptoms. So they could range from sensory changes in your body to areas of muscle weakness. And during this placement, I've learned so much about different symptom presentations, things like brain fog and paralysis and different kinds of seizures. And once we gain a full profile, one of the areas that's really specific to our assessment is pain, and how pain affects you in your body, because it's relevant to fatigue, to sleep, to memory, and to our mood. So pain is something that's so personal, and sometimes it feels like people don't really want to know about our experience with FND. But when we have an opportunity to hear about what happened to you and your subjective experience, we can understand the quality and the quantity and how you experience pain, because it's something that is in relationship. So it's a fifth vital sign of life, and the field of pain analysis is guided by the International Association for the Study of Pain. So there's a very large international body researching this area. So there's a little link, and I'm going to share the slides with you after this presentation, by Elliot Crane. He provides a TED talk, and it's really interesting to see someone with FND in recovery after working with their multidisciplinary team. So in this presentation, we're going to be looking at some measures of pain, and pain is measured in so many different ways. There are pain scales, there are pain maps, and there's also specific dialogue used to try and understand the meanings of pain for different people. There's a facial image recognition system, and something that I was not familiar with before, it's photo voice. And we want to use a particular language that's non-threatening and non-judgmental to better understand the form of communication that's relevant to the individual. so we can understand the pain signals and their distribution, how it is that they occur. So having engaged with the literature, the research on FND, I just want to emphasize that when people have some kind of belief about symptoms happening for some secondary gain, or that there is some emotional reason, it's really unhelpful. It's really important to address the pain as it's occurring and what's happening with you in the present moment. And so we don't want to contribute to any barrier or stigma around FND. We want to also acknowledge that FND and chronic pain is not your fault, even though you might feel that you have in some way something to do with it. It's definitely not your fault. So if you're a very responsible person, it's really important to try and let go of that and work with the pain experience, because it changes from day to day. So the first part of working with the pain is having acceptance. And some people really need to take that radical shift of acceptance with the saying, it's not my fault. That might be something that's really challenging for you. Understanding how it occurs, being descriptive, being able to clearly understand what's happening in your body could be a challenge. And it might be something that you work with your counsellor or psychotherapist on, or potentially you might be involved in a support group, and that's a really good safe space to discuss your experience. So locating where the pain is and measuring and looking at how to treat. So pain is a process, and it's something that in FND we know is inconsistent. So looking at the location, the description, the intensity, how long it's there for, what makes your pain feel better, what alleviates the pain, and what makes it worse. So maybe some of the triggers, some of the factors that are involved in your pain experience. So the evidence tells us that ordinary pain is typically short in duration. And pain that persists for more than 3 months is not considered normal. So when we're discussing chronic pain, it's something that's been prolonged for more than 3 months. Long-term pain activity is based on the body's memory of the pain and those signals on a loop. So they keep coming back. It's important to note here that your relationship with your doctor is something that should be addressed if you have a new pain or if you have something that's persistent, just to rule out any other medical reason for why that pain may be occurring, and just to ensure that there's no deficiency or other medical reason, there's no injury cause for your pain. So once you've resolved that matter, then you can start problem solving. So here is the first pain assessment tool that I want to present with you. And it's from a lady named Dorothy Wigram. There's many of these pain maps on the internet. If you look for a body pain map, a lot of them are front and back. Some of them have a profile, so you get a side view. But I chose this one because it has like a male figure and a female figure, but for some of them, they're very obviously male and some of them are very obviously female. So you might want to choose a body map if you're trying to describe to someone, particularly if you're unable to speak, so that you can point to where the pain is occurring. So this pain assessment, the PQRST, is a sensory registration measure, and it's similar to what we've looked at previously. So what causes the pain, what makes it better or worse, those feeling descriptors, sharp, hot, dull, burning. So however it is that you can relate to the pain in terms of description, then the region that the pain is occurring, and if it's radiating, if it's in one place, like is it consistent, and the severity. So we're going to move on to some severity ratings, but how severe the pain is for you, if it's mild or if it's quite severe. Then if there's anything that you could relate to in terms of how your pain starts, like what brought it on. I know in some people I've discussed with their FND lived experience, they've discussed smells, like they really can't go anywhere near a perfume counter in a shopping centre, or if someone comes into their space wearing some strong scent, that could be a trigger. Also, if you're affected by fatigue and you've been doing a lot, maybe that's going to be a signal for pain, or perhaps in the afternoon. So these kind of things we can map. And then you can become a resource for tracking your pain and symptom presentation. So you can notice, have you been doing too much? Are there certain foods that you've eaten that may have triggered, or perhaps you've had poor sleep recently? Other things to consider, like perhaps lighting. Lighting is something that's really factored heavily in terms of sleep research recently. Dimming the lights according to circadian rhythm. So when the sun goes down, if you're going to have light, we need light to still continue with our acts of daily living, but perhaps you're not having down lights, you might have some up lights, and you might choose not to have any kind of fluorescent lights that may flicker. And then there's the thoughts relating to pain. So pain is something that's really important for our health and well-being. It might sound a bit ironic, but analgesia is the capacity to feel and sense pain, and it's something that protects us. So when we're having a pain experience, if you'd like to try and just understand it's part of living and just go, okay, what's this pain trying to tell me? So this is quite a complex rating scale that we have here. It's called the Numeric Pain Rating Scale, and it is required on 3 occasions in a 24-hour period. So it's not just a day. So your 24-hour period from when you're starting could be from now and looking back at this time yesterday. So the mild rating, the moderate and the severe helps to categorize how your pain is affecting you. And if you're taking some kind of medication, then you can tell after the medications started to take effect if it's actually reducing your pain symptoms. So it's useful in that way to measure. Now, as we go to the next descriptor, this is called the pain thermometer, and it's a more of a vertical measure. So it is based on the old style thermometer, not necessarily the digital one, but again, it's administered 3 times across a 24-hour period. These measures are used to deliver verbally, but again, they're freely available on the internet. If you were to Google pain thermometer, you'd see a whole variety of these in different colors. And they simply provide us with a visual representation to gauge where our pain is at. One of the instrumental aspects of this is the wording that the individual uses. So for example, if someone says, you know, that they're aching, I would ask them, well, where is your ache? You know, and then get that rating for the ache, for example. So pain might not be the word that's preferred. So you might like to negotiate that with your caregiver as well, if that's something that you're going to be relating with and utilising one of these tools. So pain is unique, and we've got this little fingerprint which looks like a heart shape because it requires for us to be kind to ourselves to address our own pain. So again, leave the blame out of your interactions with pain. So a pain diary is an excellent method to chart your pain incidences and really be able to refer to episodes in the past, particularly if you're going to be speaking with someone, you know, who's managing your FND experience. So this is probably one of the most simple visual analog scale. No pain and very severe pain, So you can adapt it. You don't actually need to download anything off the internet. You can just literally draw a line and have your 0 to 10 if you like, or just, you know, at the beginning is your lowest rating and at the end is your highest. Perhaps your pain is somewhere in the middle, or below or above that midline. So it doesn't have to be a complex kind of rating. So again, there's lots of variations as we come to this Wong-Baker Faces Pain Rating Scale. And the variations, again, you'll see them in colours, and you might see more than 5 if you were to Google these. So when I conducted this search, I discovered that I have been using this, and I didn't realise it was made for children, because children often have difficulty expressing themselves. And it was something that's really simple for them to just point and let the nursing staff know how they're feeling. So I just wanted to draw attention here that there was a study by the Australian Pain Society, and it was a project that screened health professionals. It's called the Waiting in Pain Project. And the evidence demonstrated that the longer someone waits to be treated, the worse their pain becomes. So if you are having a bad pain experience, do get treated. Don't think that you have to wait it out or suffer. And your pain scale might help you in addressing that, you and your caregiver. So this slide brings us to chronic pain. And we've already discussed that chronic pain is something that exists for more than 3 months. So that's considered past the natural course of healing. And it could be an indication of a disease process. So as I mentioned before, pain is very valid and significant. So people might say, oh, I have a high threshold of pain, or I have a low threshold of pain. So our measures that we've just looked at help us to identify those thresholds. However, what we don't want to do is really be comparing in that way. We need to be individualized in our approach. The thing about chronic pain or high intensity pain is that it can affect our ability to perform, particularly if there's something that's demanding our attention. It can have a serious cognitive impact. So some of the treatment approaches that are used to alleviate chronic pain are the steroidal injections, nerve blocks. That intramuscular butylium is basically Botox. So Botox injections can help to relax muscles that are otherwise non-responsive to relaxing. There are surgical methods, and there's also medication. So we've come to the slide on complex regional pain syndrome. So this is a completely different category, and there are sensory changes in the body. So things that might actually cause pain. We can determine the sensory changes, and some of them are temperature changes, like you might notice that the skin becomes a lot cooler or hotter. Some of the other changes might be sweating or stiffness, swelling, restricted movement, unable to weight bear. Some of these things are really things that we're familiar with in terms of FND. So we've finally arrived at the slide, which is about the feel good, the pain relief relationship. So when I was looking at the research, it talks about the multidisciplinary team treatment and how essential that is. But there's also this caveat that says, whatever helps you to alleviate your pain or to feel better might be a good go-to for you. And so I've just listed a few here. Your psychotherapist might engage in hypnotherapy. They're really effective forms of dealing with FND and pain management. There's a few here, like acupuncture has been researched as effective for pain management. Osteopathy, it's kind of like a cousin of chiropractic, if you're not familiar, only without the cracking. So osteopathy and craniosacral method are very gentle. Craniosacral, as the name indicates, it's supporting the base of the skull and also the sacrum, which is the lower part of the spinal column that integrates the pelvis. Alexander technique and Feldenkrais about freedom through movement, but the approach in Feldenkrais is quite small movements, slow movements. Bowen therapy moves across a muscle direction to release it, and body harmony is like a blend of all of the above. So the thing about these is they can be quite costly, but if you see a therapist or a clinician who is a hybrid, like for example, you might see a GP who's also a naturopath, and there might be an opportunity to bulk bill in some of those different areas. Some practitioners in the field of physiotherapy, you might be gaining your acupuncture through them. Some GPs also do acupuncture. But moving on to e-stim or electrical stimulation, you might have heard of TENS. Transcutaneous muscle stimulation is another term, and often this therapy is recommended by physiotherapists, and a lot of people find that it's really effective in retraining the sensory motor pathways. Myofascial release is a way of looking at how the muscles move and the hydration of the muscles, and a lot of people find relief through using a ball or a rolling technique to release pain and strain that might otherwise be retained within the muscle and soft tissue. So that is like a form of massage, and massage could be another area that you find effective. And then just the next line below is our hydrotherapy, floating, geothermal, bathing, and sauna. So those wet therapies. And then going on to some of the other lifestyle things that we can introduce to relieve our pain, like singing, chanting, laughing. If you're not familiar with laughter as a therapy, it is out there in the community. You can get together with a laughing group, and laughing groups online has wonderful benefits for mood elevation, and also there's some evidence to support that it helps with healing and remediating pain. So basically doing things that you enjoy, things that make your heart sing. So moving on to person, pet, and nature. So being in nature is something that has been shown to downregulate the nervous system. It's calming and soothing, which has a really good effect on people who have chronic pain and alleviating stress. So pet therapy is something that's really prominent in the community now with assistance dogs. But if you're not a dog person, you might be a bird person, or you might like cats, or perhaps some other kind of pet. So it's not exclusive to dogs. Pets have been shown to help us with our emotional regulation and really bring down our levels of stress, which is important for lowering pain. And if you don't have a lot of nature or animals around you, you can connect with other people because we are also natural. But even if you live in high rise, perhaps a plant could be bringing nature into your space. And even having images on the television, they can be effective for the pet therapy. Just watching something like David Attenborough can really bring about that animal-based therapy. So becoming curious about what brings you comfort and self-soothing is part of this mapping for planning how to take action steps towards alleviating pain as your goal from being free from pain. And also it goes without saying that nurturing yourself with a balanced diet and hydrating well can also be helpful. So we're developing a compassionate awareness. And compassionate awareness is something that's really important in terms of East meets West treatments. So you might be familiar with some of the list like Qigong. It's kind of a cousin of Tai Chi, only much more flowing and gentle. There's Drew Yoga. You may or may not be familiar with that in your community, but I can assure you that it exists pretty much everywhere in Australia. And due to our online connections, a lot of people find that they're connecting with their Drew community online. There's also restorative yoga. So if you're not familiar with restorative yoga, basically support yourself in a posture, because supporting the body in a position is beneficial for the nervous system. Again, there's a lot of information about this online. Make sure that you're away from any draft or any cold. So lots of blankets are used in the technique, and you basically stay in each posture for approximately 15 to 20 minutes. So it's very soothing for the nervous system and soothing for the body and mind. And there's somatherapy variations of these as well. So I shared a link next, which is on ocean breathing, and I'm hoping you might join me now in a little exercise. So wherever you're seated now, if you'd like to bring one hand to your belly and just feel how your belly is feeling. So we're going to relate to the belly as the ocean. So if you consider how each breath cycle might be moving your abdomen, it could be very subtle, or it might be quite a good swell there. And then if you like to bring one hand to your chest, this is like the shore. So you can experience your breath like gentle rolling waves. It's a way of regulating the breath. And the evidence around this feeling, sensing of the breath helps us to get in touch with the breath, and it also supports self-mastery. So it's sometimes called a victorious breath, but it basically has this visualization of rolling waves. So as you lift your front body opening with the in-breath, and then as you fold your front body forward with the out-breath, it's this kind of movement that you might find that the practice only takes 2 minutes to help you to reduce your pain symptoms or help you to feel more whole and present in your body. And if you're able to hear the sound of the breath as well, that's the component that we really want to look for. So that's our ocean breathing. If it feels okay, just have a bit of a shoulder movement as you come out of the practice. So for some of us, if we have a longer, more persistent symptoms, we might need to practice for somewhere like 8 minutes, or maybe 10 minutes to have a really competent effect there. So relaxation and meditation, I have shared the iRest method because it's evidence-based and it's been tested on war veterans. So it's shown to be very effective, not only with war veterans, but also people with multiple sclerosis. So there's a high level of efficacy. There's a 10-step protocol that I've shared. And then there's something that you might be used to in terms of distraction, which is the finger touching method. So as you move to each finger, you might practice it one breath at a time. the practice that I've been taught is a sliding or a gliding technique of the finger down to the base and then back up. And so as you move from one finger to the next, this technique might be something that you find is effective to your pain management and self-regulation. Oh, okay, so we're up to pendiculation, which is a yawning method. So we're moving right along with our strategies. And I've put in an image here of the vagus nerve, because the vagus nerve and the yawning method is an area where we really gain a lot of benefit. It's the 10th cranial nerve in the body. It's something that when we yawn, it's kind of tricking the body, or almost like a distraction, because the brain senses yawning like a normal resting state. So it's like being on either side of sleep. So as we practice yawning, and you might have been taught not to yawn in public. It might be something that's socially not acceptable in terms of your values and the way that you've been raised. But I'd like to encourage you, if someone yawns, you might pick up the signal of a yawn. So the mirror neurons, the way that they work in the body, if you need a yawn or that kind of release of the jaw, you might even look at a picture of someone yawning to get the effect. So it's a coordinated movement that happens. It helps with restoring and resetting the structural function areas of the brain. And one of the side benefits is that it gives us some tissue integration. So neuroimaging shows us how yawning, stretching can reduce pain and positively affect our attention and working memory. And I'm just wondering if you might join me in a small method of pendiculation. So if you'd like to start bringing one hand to the side of your body and just slowly drawing it up towards your underarm and slowly rubbing it down and extending your arm down. So if you'd like to do this together, just bringing an arm up and lowering it down. Now, these obviously depend on how much function you have in a day with your upper limbs, and you can do the same kind of movement with your lower limbs. You might even feel, if you've ever been to a Pilates mat class and you're dragging your limbs along or using your limbs as levers, that it is very similar. It has a remedial approach. Now, if you bring one arm up and start to fold to the side, it might start to bring a bit of that yawning sensation through the body. And as slow as you'd like to go can also help to relieve the effect, and try and let your head go with, not keep your head fixed. And so as you might have moved from one side to the other, the double movement might also be beneficial, but never rush these techniques. Take your time. So the double one, it might come with an inhale, moving both arms up the side of the body and both arms back down. So you might feel changes in your breathing as you do this. If you feel that you can go a little further, if you feel comfortable, you might actually bring your hands up and over your shoulders and go into something that's like a real yawning stretch. And there are so many ways to yawn. You can yawn lying, standing, seated. And for some of us, just bringing a hand to the back of the head and even supporting the back of the head brings that yawning kind of a sensation. So there are different signals in the body. So I'm hoping that we can have one more Oh, one more practical experience. Okay. So freeing movements improve posture and reduce pain. So this technique that I'm going to ask you to enjoy with me is something that the work of Peter Levine in the somatic space works with, and it is like growling. So his technique is awakening a tiger, but it helps with yawning stretch. It prepares the body to sense. So sometimes we try and ask the body to do things when the sensory system isn't really ready and online yet. So it awakens the body map, and it's been likened to updating the software. So if you will join with me, maybe your inner lion is not feeling so ferocious today. Maybe you're feeling a little more playful. So you might be like, rawr, rawr. And your mics are closed, so no one's going to hear your roar. But if you're building it up like, rawr, the noise is important. So if you can, rawr, you might make it gradually increasing with your sound to something more like this lion position, where you might even to help regulate your pain. So I'm going to invite you to open your mics. Oh, there's all of our references. And thank you very much for attending. So does anyone have any questions?
Thanks, Lee. That was really interesting.
Thank you. I apologise if you can hear someone chopping a tree down in my
No.
vicinity.
We can't. Well, I can't.
and mulching it.
Yeah, no, that didn't come through.
Okay.
I had a lot of yawn through that though. It didn't come through.
Okay, beautiful.
Yeah.
So yeah, never hold back on your yawn if you have an opportunity to express it. Hi, David.
Hi, Lee. Thanks for the presentation. It was very informative. I guess I don't really have questions as such, but just wanted to give you some feedback that I thought the content was very useful. Obviously, pain's a very nuanced thing, and just to understand the language that you guys think and talk in, I think is helpful for us on this FND journey to know how to communicate with allied health professionals and medical people about pain. But there are challenges, not so much for the carer, but for the patient, just given the complexities some people have with communicating. So it's good to see some of those tools that you guys use just to help get that message of where the pain is, what the quality is like, how severe it is. And just on the back of that, of all the appointments I've attended with Victoria, whether it be a neurologist or psychiatrist and even the GP, there's been very little discussion with them about any of those aspects of Victoria's pain, even though it dominates her day so badly. No one has taken any time to really explore what that means for her physically and what it's doing for her from a practical point of view. And there's just been a few prescriptions written for various drugs which have done nothing, absolutely nothing. So just a little bit of feedback for you about, what's going on for her, and just where we found this presentation useful. Thank you.
Thank you. And I'm really sorry to hear that, Victoria, that you've had that experience and that your health professionals aren't really working with you in that therapeutic relationship, because, it can feel so invalidating, but we understand that a lot of health professionals are feeling burnt out and they are stressed and they've got a huge client load. But if you can maybe utilize some of these tools to relate with them, things that they're familiar with and recognize, I really hope that it does improve your journey.
Yes.
Because, if you have a look at when I send out the slides, if you have a look at that TED talk, like the reality of pain as a disease, I mean, it's evidence-based. And if anybody doesn't validate your pain, well, perhaps they're not the person for you to be working with, or maybe you need to see them in terms of a particular area of your treatment and just work with someone else in that area, because it might not be their sphere.
Yeah, we're even thinking that a pain consultant or a pain management expert might be something that might need to be looked into in the future.
Yeah, and who knows what is going to work for you. If you don't try, you might not know, but if you do try once and there's a package offered, ask them to reduce the package, because these treatments and therapies can become very expensive. So yeah, that's why I had to add in all those little things that might be able to alleviate in your day-to-day that are inexpensive. I really appreciate the feedback, David. Thank you so much.
That's right. Thank you.
And I think those scales that Lee shared can be a useful communication tool. So when you're going to the doctor, if you're trying new medication, showing, is there any impact on these pain scales? So if I, take the medication in the morning, has my pain decreased at all? Or if it's not having any improvement, it's not worth pursuing that medication, because medications, they often do come with side effects. And a lot of people do see a pain management program, and they have FND. People who live with chronic pain as part of FND often attend pain management clinics, because pain is such a common symptom of FND. Yeah, it's highly under-recognized, and the impact of it on people with FND, the impact of pain, the impact on fatigue, and how debilitating it can be is, not really recognized.
Do OTs deal directly in helping people with pain, or is it just something that you kind of...
I think, yeah, no, I think some people will specialize in that area. So OT is a highly diverse field, and because it is so diverse, we do need to specialize. So there'll be some OTs that sort of specialize in that field or that work predominantly in that area. But I think just picking any OT is probably not the answer. It's sort of finding out, does this OT have an interest in this area? Do they work in this area? Because some definitely do, absolutely, but definitely not all of them.
Okay.
Yeah.
Okay. Thank you.
Yeah. Right. Are there any other questions or comments? Just feel free to turn off your mic and jump in if you've got any comments. Erin.
Yes, hi. Thank you very much for the presentation. I don't suffer from too much pain myself, but anxiety is probably my biggest issue at the moment, and the breathing techniques and that are very helpful for me in different situations and things. So yeah, thank you very much. And it's good to feel a part of a group. It's hard sometimes not to feel like you're the only one that's got this and you're dealing with it all on your own. But yeah, thank you very much, Lee and Catherine as well.
Yeah, it's been great to have you. Thank you so much for being here. And I hope that you do have some support networks that you can reach out to so that you don't feel alone, because you're definitely not.
Yeah.
Yeah, and I think that there's so much to movement and so many different techniques. So just trying them and seeing what works for you, and not being judgmental, because you're having a hard enough time as it is without adding to that. So trying to just be opening yourself to that discovery and being curious, that's a really important part. So,
and in FND, working with the body, like your somatic therapies, are so important, whether or not it's for pain or for other symptoms. I tend to find anything that's going to downregulate the nervous system, so it can be useful in your pain, but it can also be useful with any other symptoms that you have. And it's experimenting, as Lee said, and finding what's going to work for you. Lee mentioned the vagus nerve. I mean, that's just sort of so important in terms of regulating the body regulating our nervous system, because we don't have damage to particular points in the nervous system. We've got a disorder in the functioning. So anything that's going to work with the body and work with the nervous system is going to be helpful for your overall symptoms and how you're feeling. And, you know, it's not like a magic cure. It's something that you got to work with, you know, basically every day, looking after your whole body, and really taking that holistic approach. Yeah, that's not like there's this magic bullet. And in terms of, you know, pain meds, often, you know, doctors might prescribe one pill. It really doesn't solve the whole problem. There's not a magic bullet kind of cure for FND. Yeah.
Yeah. Thanks so much for contributing, Kate, because you're the expert in this field, and your expertise, I mean, you've worked with so many people in terms of this condition and their personal journey. So I think that there's so many great resources on FND Australia, like on the Facebook, and there's just an immense amount of techniques that are available. So yeah, it's really, really worthwhile for people to get involved.
Yeah. And in terms of like the evidence base, the somatic therapies I find can be really, really helpful, but the research with FND is lagging so far behind. So it is being open and experimental, and working with, you know, the alternative therapies that you mentioned, Lee, I do find they have so much benefit for people with FND, but it's not like there's a lot of research behind it. Like there's been no sort of, you know, double-blinded clinical trials around the role of acupuncture and yoga and that sort of stuff. But anecdotally, when I've worked with people, I've seen when people have gone down that sort of alternative pathway, people have improved. And things like the acupuncture, your trauma-informed yoga, I've seen massive turnarounds in those areas. But as you mentioned, like, it can get quite expensive. And it's not sort of something, even NDIS doesn't recognise those alternative medicines. They go, oh, it's not enough evidence, but it's around the evidence, you know, your evidence, does it work for you? Yeah.
Yeah, that's why there's case studies. I mean, there's not a lot of funding being put there, and it's interesting how where the funding goes, there's a lot more evidence. But you know, who knows what might happen in this space in the future in terms of funding and, you know, the evidence that we can provide. But definitely case studies are there. And I think that a lot of the relevance comes from cancer work, because there's so much funding in cancer. And, you know, that's where the evidence around the acupuncture and the pain relief is really there, as well as in, as I mentioned, the war veteran space. There's obviously funding there as well for the vets. Yeah.
All right. Are there any other comments or questions people want to make before we wrap up? No. Okay, well,
Keep
thanks.
yawning, people.
Yeah. Yeah, and like you mentioned, you know, it's sort of like not socially acceptable, but there's kind of like a physiological reason. And like, I know when we wake up in the morning, we all stretch. My animals do it, I do it. We all wake up and stretch automatically without thinking about it. And there's obviously like physiological reasons why we do that. And we often sort of don't tap into those natural, you know, body movements, I guess. So yeah, so that's the last of our webinar series for this group of OT students. So thanks to Lee, Sky and Emma. They've done, you know, webinar each, which has been fantastic. I love having the students because they bring their own areas of expertise and interests, and, you know, provide more opportunities, provide education to our members. So thank you for that. It's all been useful. And Lee, you'll send me the recording, won't you? Yep. So then I'll upload the recording and I'll share it on the group so that people can watch it back later. And we'll also send a copy of the slides out.
Thank you so much.
Okay.
Bye.
Bye.